Welcome back at 7:15. Kids are heading back to school if they're not already back to school this week. And for parents with kids that have food allergies, preparation is everything. With us this morning, Dr. Andrew Abreo, pediatric allergist at LSU Health New Orleans, here to help families get ready for this new school year. Dr. Abreo, good morning. Thanks for being with us.
Thanks for having me.
So let's talk about the things that parents should have been doing, especially leading up to this week, because this is kind of the week that kids are heading back to school, or in the first few days of school, to ensure those children with allergies are ready.
Yeah, so absolutely. So, for families with food allergy, the most important step is preparation. So, the best time to have a plan in place is before a reaction even occurs. And so this time of year, I typically recommend families schedule a visit with their pediatrician or board certified allergist to set up a time to discuss their food allergy action plan. This is a written plan that describes the symptoms of an allergic reaction and the emergency treatments that are necessary to treat an allergic reaction.
And those written plans are typically turned in with any other paperwork and documentations that kids have to turn in at school at the beginning of the year, right?
Absolutely. So this is also a good time to get an unexpired updated epinephrine auto-injector. And at that visit, your pediatrician or allergist can fill out some school medication forms so that you can actually have emergency medicines not only at home, but also at school. So we typically turn in the food allergy action plan and the school medication forms.
And let's talk about signs and symptoms parents should be watching out for. So that's if you know your kids have allergies. Let's talk about the smaller children heading back to or for the first time going to daycare, those infants, those toddlers. What should they be looking out for? What should the caregivers in those daycare settings be watching out for as far as allergies are concerned with those toddlers and those infants?
Right. So the classic, symptoms of an allergic reaction typically develop within a few minutes to hours after eating of food. And the classic symptoms involve the skin, so hives or swelling, breathing issues, coughing, and sometimes stomach issues like repetitive vomiting. And so for those young kids, infants and toddlers, they may not be able to communicate, right? And so you have to look for some behavioral changes, not only the classic symptoms, so fussiness, irritability, maybe even being a little bit more withdrawn after eating.
So let's talk about if a child does go to daycare, an allergy that a parent didn't know about is discovered. Right. What should the next steps be for those parents? Kind of same thing for the bigger kids, or what should be done maybe in a clinical setting to introduce other allergens to maybe rule out other allergens before they head back to school or daycare?
So definitely a scary experience for a lot of families and parents. And so the first thing is to touch base with your pediatrician, and they'll listen to the signs, the symptoms, determine if the pattern really warrants referring to a board certified allergist. And at that time, we'll complete, a comprehensive evaluation, sometimes doing allergy testing to identify a specific trigger, create an individualized care plan. And so really what you're getting at the end there is that early introduction can be really important to reducing the risk of food allergies. So when kids are developmentally ready, between 6 to 12 months of age, introducing those common food allergens can be really beneficial in the long term. The most evidence supports early peanut introduction. There's been a lot of studies that have really supported that idea.
We only have about 10 seconds left, Doctor. So really quickly, there's a lot out there that can help parents navigate the world of allergies and dealing with that, because it can be frustrating for parents, I would imagine. So what kind of resources, or where can they go for resources as they're navigating new school year, potentially new allergies with those little kids?
So our group of LSU Health pediatric allergists and immunologists, we're at Manning Family Children's. We're really standing ready to serve the community, to evaluate food allergies, other allergic and immunologic conditions. If you have any other questions, you can head over to lsuhsc.edu. In the top right, just search allergy, and you can learn a little bit more about our program.
Dr. Abreo, thanks so much for your time this morning.
Thanks for having me.